third year class is going into your school placement soon. Oh boy, you're gonna have a lot of work to do with those youngins. Yeah. What placement are you guys in? Elementary. Okay, so lots and lots and lots of loving care and lots and lots and lots of lice checks are in your future. Very fun. Hopefully you can learn a lot from this lab so you can get a good grade and pass your clinical. Yeah. Okay, so in today's lab, I will be doing a in front of you demonstration, and then each of you have a head with a wig to do your own practice assessment as well. Okay, I will be walking around the room after to check on you and watch you perform it so I can make sure you have the right skills. Okay, great. So to start, let me introduce you to Morticia, my sweet, sweet lady. I must apologize directly and only to Morticia for this heinous shake and go wig that they forced me to use on her. She deserved better, but as we all know, budget cuts affect everybody. So unfortunately, my sweet girl Morticia got this atrocious wig that we're just not going to look at the bangs. But it is what it is. I can still do the instructions, so be kind to Morticia, please. So, to start, the first thing that you need to know about doing a lice assessment is... Anyone? Yes, you need to do a patient assessment. That is correct. Before we ever put our hands or use any tools for any patient to do an actual lice check, we first must do some patient research and some patient discussion to find out what symptoms they've been having. Yeah. So everyone pull out your notebooks, please. Pull them out, guys. Come on. Okay, great. So I want you to write down these next questions because you are going to need to ask them to your head before you begin, just for practice. Okay, so the first question, and keep in mind, your students may not be able to answer these questions as coherently as you wish, but do your best to get the best answer out of them that you can. Okay, so the first question is your scalp itchy? Is your scalp itchy? So that is a very common sign of lice. They do make your head very itchy, so you will often hear kiddos complaining of having an itchy head, or they might just literally be itching themselves in your office. Yeah, they're not always the most subtle. Okay, second, you're gonna ask, have they been in contact or have they seen anyone with lice recently? So this is hard for some of the kiddos to know. They might not know, but a lot of the times when a kid does have lice, a notice goes home for the class that has been exposed. So they might know something about that, but you might also know something about that from the administration. Okay. Question 3 is, have they noticed any crawling things in their hair or on their scalp? This might creep them out, and that is fair. Lice are very creepy. But it's important to know, have they noticed that? Have they noticed things in their hair moving around, things like that? And finally, the last question is, have they been scratching their head a lot and they noticed like scabs or things underneath their nails? Yeah, so a lot of times if they're scratching, they can either get lice or scabs from scratching under their nail bed. So it just gives you an indication of how healthy their scalp is. Yeah, so with those questions on the way, I want you to write down the answers so you have it for your report. Okay, once those questions have been done, you are then allowed to begin the actual assessment. Right, so with Morticia here, I will be doing a trial assessment to show you what you can do. It's not a very glamorous procedure. It doesn't require any intense medical equipment or tools, but it is a very important skill to know as a new nurse. Okay, so step 1 to any assessment is to wash your hands and then put on a pair of gloves. That's right. So I will be wearing these gloves today. You can use whatever gloves are provided to you by the school or by the hospital if you're doing this in a clinical setting. So, before you put your gloves on, as I said, always wash your hands with soap and water or hand sanitizer, whatever is available to you. And you'll put on your gloves, just like so, and the other one. wear gloves when we're going to do an assessment? Okay, yeah, one reason is that we want to keep ourselves clean and acceptable so we don't get in contact with lice. That's a good point. And two, it's safer for the patient. Just anytime you're contacting any patient, you should always have gloves on. True. What am I currently doing right now, class, that I should take care of before I begin my assessment? What am I doing that I'm putting myself at risk? What am I doing? That's right, my hair is down. My hair is down. My hair is down. If you are doing a lice assessment or are providing any level of patient care, your hair should be up in a ponytail or in a bun on the top of your head. Now, because I am an instructor and I'm not in a clinical setting, you are going to pretend that my hair is up, but you will not do this in your clinical practice or you will get a F. That's right. That's just how it goes. So, now that my hair is out of my face, I have my gloves on, I have asked the patient the questions I need to know for my charting. We are going to begin the actual assessment. So to begin, you're going to ask your patient to sit or stand if they're short enough, but sitting's more comfortable, at a comfortable place because you're going to take a little while to do the assessment. And you're going to ask them if it is okay for you to touch their head. Everything in medicine should always be about consent. So if they do not consent, then you can't really go ahead, but in most cases the kiddos are fine with it. So if the kid says yes, which hopefully they will, then you are going to first start with some light palpation and inspection of the scalp. There are four primary areas that we need to check for lice. They go from the front to the back. Okay, so first is the bangs. It may not seem like this is an important area to check because it's just the forehead underneath there, but a lot of times lice like to hang out at the actual base of the bangs near the very front of the forehead around here. So that is check spot number one. So let us get in there. You're gonna peel apart the hairs here, taking a look at the scalp in multiple different areas. If you do not see any lice, you will document this in your charting. If you do see lice, you will do your best to estimate how many specific lice you see, and you will document that in your charting as well. Alrighty, so far for Morticia, I am not seeing any lice here, but I'm going to do a thorough job and make sure I check along the entire hairline. Okay, so next, now that we've gone from the bangs, we are going to move to the scalp. The scalp, often the part. Some people have side parts, some people have middle parts. That's just how it's going to be. So we're going to go right on the top and we're going to take a look. At this stage, we are not going to be manipulating and moving hair too aggressively. We will do that later with a comb. So right now, we're just kind of getting the lay of the land, checking out for basics. So you're just going to feel around, and you're going to look at the primary part that they have in their hair. So for Morticia, it's just in the center here, and we're going to inspect for lice, as well as looking at the health of the scalp. So, during this section, you're going to look for lice, you're going to look for egg sacs, and you're going to look for scabs and irritation. Okay, so if the patient has been scratching their head a lot, there is a good chance that you will see redness, increased dryness, or possibly scabs in their scalp. So that is something to look out for and to document as well. So we are checking, we are looking, getting a feel around, and so far so good. Morticia looks pretty clean here. Okay, so that is the second area. So we got the front, we got the scalp. Next, we are moving to by the ears. Another common place for lice to hide out is just along the upper part of the ear, or right where your glasses would sit, back here. So, unfortunately for Morticia, do not tell her, she's very sensitive about it. She does not have ears. So we are going to pretend she has ears, and I'm going to check that area. So moving her hair, I am looking for lice, I am looking for egg sacs, and I am looking for signs of irritation or scratching. So around the top of the ear, behind it, and down to where the glasses would be The last section that you are checking before we begin the big assessment is the nape of the neck. The nape of the neck. So what that means is the back of the head, right where the scalp line meets into the neck. Okay, another common place for lice to hide. So to the back of the head, you can get your patient to look down if you need to. You are going to part their hair for them. Bring it forward. And you're going to inspect the back of their head. So in the back of their head is a common place to see lots and lots of scratching, especially if kiddos are going to down at the back of their head. So it's easy to see long red scratch marks if they've been really itching. Okay, so we're looking for lice, we're looking for egg sacs, and we're looking for irritation. And for argument's sake, sorry Morticia, your hair is falling off, sweetie. For argument's sake, we are going to say that Morticia had lice that I found at the nape of her neck. Poor thing, that's not very fun. So now, we are going to begin a thorough assessment of the entire top scalp, and then we are going to do a combing, a brushing, to do our best to try to remove some of the lice before we do, and recommend a lice shampoo for at-home use. Yeah, okay. So everyone pull out the brush they were given in their lab kit, please. Pull them out, pull them out. Did everyone bring one? Did everyone bring their lab kits? Okay, great. So anything similar to this type of brush is perfect. You want something with fine bristles and a pointy tip. Fine bristles and a pointy tip. Okay, so using the tip end of the brush, we are slowly going to make sections of the hair and flip them over and move them back, just so we can have access to the scalp. So we're going to be looking for areas that seem more irritated or have lice by checking the entire scalp systematically. So I recommend when you start looking from the middle part or wherever the part is, take to the left or right side, whichever side you prefer, and keep making cuts, probably about 5 to 6 different parts along the way to check on one side, switch over and do it on the other. Okay, so let's start. So I've already seen Morticia's middle part. It seems fine, but now on her side here, I'm going to run my brush along, and I here have access to her scalp here. I can see a different area of her scalp. So I'm going to take a look at that. I'm looking for lice, I'm looking for irritation, I'm looking for anything that could be out of the ordinary. Okay, that part's good, so let's move a little bit further down. Using that as a part, pulling up here, new access here. Another area for scalp to look at. Okay, doing pretty good. Another one down here. And of course, keep in mind, class, this will be easier to do on real people. Wigs have like a net underneath, but real people have hair in their head, so it's easier to part and move. Alright, so not much going on there. Let's do another one down here. Okay, looking pretty good on the scalp. And then I always recommend doing one a bit lower down below the ear on the side here, just to get a thorough look at it, but it looks pretty good so far. Another thing that will not happen is their hair will not slide around while you're doing the assessment. Okay, so now we're going to do the exact same thing on the other side. So let us pull over here. Okay, so this area of her scalp is looking pretty good. Another part down here. Yes, that looks pretty good. And I'll look over here. Yes, so far so good. Another part down over here. Good, and one more down at the edge. Yes, okay. So far, so good. No issues on the top of her scalp. And now you can do the same thing on the back of the scalp, at the back of the head. You're going to do parts, and instead of doing vertical this way, you're going to make horizontal cuts or horizontal slits across the head like so. So let's start in the back. Let's go like this. Lift this hair up. Take a look. Okay, so this is Morticia's problem area, is the back of her head. That's where I'm seeing issues in this example. So when I pull this up, I can see about 3 moving lice and a couple egg pods as well. So I'm going to document that to put in my notes for later. And now let's take another one. Lift that up. Same thing. Morticia is pretty good in the front and sides, but her problem area at the moment is she has lice at the back of her head. Okay, so now, as a way to kind of see how everything's doing, we are going to use the bristle side of the brush, and we are going to brush through some of the hair at the back of her head, starting right at the nape of the hair, so as close to the scalp as we can, and then we are going to brush through, just to see if anything comes out while we do it. You might get lice on your brush, you might get egg pods, you also might just get some scabs and dry skin as well. Okay, so let's start that at the back here. So we're going to go right in. Okay, and we're brushing, and we're brushing, and we're brushing, and we're brushing, and we're brushing. Okay, so in a normal situation, you might notice a buildup of material on your brush while you're brushing. That is also something you will document in your notes. Okay, so from here, this is the final check that I like to do. It's just to do how your whole head feels. So you're just going to feel and ask the patient if any areas feel itchy or scratchy or irritated compared to other areas. So we'll start at the front. So Morticia, does this area feel itchy to you? No? Okay, so we know this is probably not a problem area. Let's move to the top. Okay, Morticia, does the top of your head feel itchy when I touch it? No? Okay, so it's also probably okay. Move down to the side of the head. Does that feel itchy, Morticia? No? Okay. Not bad. And then we'll go to the back of the head. Does anything in there feel itchy? Yes, okay, so that feels like the most irritated area. So that is also something you will document. This is also a great time to ask your patient how itchy or how painful areas of their scalp feel on a scale from 1 to 10. 1 being nothing at all, 10 being the most itchy or most painful they've ever felt. Do keep in mind, kids tend to trend towards extremes when they answer these types of questions, but you have to write down what they answer and you can go from there. Okay, so with all that information in place, I think you guys are ready to do your own assessments in lab. Right, so I will walk around and watch all of you. If you have any questions, please come to me. But this lab participation is part of your final grade, so you best be doing your best while I walk around and take notes. Okay, if you have any questions, come see me, but enjoy the rest of your lab.